Hello, my name is Imtiaz Aziz, and I'm a senior HR professional, and I've been in the HR field for over 30 years. On Friday, the 19th of April, Rishi Sunak, the Prime Minister, gave a speech about the sick note culture. Where does it start? What was he talking about? Was this a major change? These are all the questions I hope to address today. In 2010, the then Conservative government introduced fit notes. The principal aim of the fit note was to address one particular issue, which was, is the employee fit for any type of work? Not that they're just completely unfit for work. In 2013, there was a review conducted of the success of the fit note, and it recorded essentially the same findings that we're seeing that Rishi Sunak was presenting on Friday. So why has it taken the Conservatives some 11 years to come to the same conclusions that we saw in 2013, which is that the fit notes weren't being used for the purpose for which they were actually intended? And that was to try and help employers and employees with a central question, which is the employee fit for any type of work? Not that they were unfit for the work that they were initially engaged in. And so the Conservatives have sat on their hands for 11 years. They've had the evidence, they carried out the review, they know that that's what the situation was. So what we saw on Friday was very simply electioneering. It wasn't a genuine attempt to deal with what is a really serious issue within the workforce, which is the way that those sick notes have not fulfilled the purpose. But there's one other thing that I wanted to address, which is the government is talking about other healthcare professionals, I assume, giving out fit notes. I personally think that's a good thing. But I'm starting to feel that we're building in additional costs within our healthcare system. So if I'm an employee who is currently unwell, I will go to my GP. Now I will need to find another healthcare professional who will then sign me off in terms of the fit note. But that healthcare professional can actually treat my illness. So I'm now going to have to go back to my GP to get treatment. And because the vast majority of the issues that are highlighted in terms of the use of the fit note is around people with mental health issues, it really comes down to what support is there that the government is providing, that the NHS is providing for patients with mental health issues. And we know that this is an area that is under-resourced. So what do we have? We have a Prime Minister standing up on the Friday talking about the sick note culture, but putting no money in place. Putting nothing in place to support people with mental health. I'm a HR professional. I want to see people back at work. I want to see them as productive as they possibly can. I want to see them making a contribution to the organisation in whatever capacity that they can, depending on what their illness is. So the general philosophy that Rishi Sunak was putting forward, I buy into. And who doesn't? Remember, when someone is off sick, unless they've got a company sick pay scheme, they're on statutory sick pay, which is, quite frankly, a pittance. So there's no huge advantage to them sitting at home. And the implication on Friday was these are lazy people. These are people that are malingerers. And as a HR professional, I know there are some that fall into that category, but the vast majority aren't. And so I think part of what Rishi Sunak was talking about was the reasonable adjustments, the support that can be put in place to help people back into the workplace. I buy into all of that. I'm definitely on that boat. Where I think this really lets us down is, where is the money? This is pure electioneering. This is nothing more than that. It's not a genuine attempt to deal with what is clearly something that is a significant issue. And I think it's also important to highlight that we live through a pandemic. And all HR professionals will tell you one thing, that we've seen a significant rise after the pandemic in mental health issues. And those people that are in the education sector will tell you that there's been a rise of mental health issues with young people within the education field. So we need investment in the mental health services of this country. And maybe then, Rishi Sunak, you can genuinely address the sick note culture. Thank you very much for listening.